Why does the COVID-19 virus keep spreading when majority of people are in lockdown? Who is it spreading from and to whom exactly, and why do we need months and months of quarantine to get rid of the virus? First, SARS-CoV-2 is most unusual in that it has an incubation period of up to 12 days, compared to 5 for most other coronaviruses and influenza viruses. So even if everyone in an area enters a perfect quarantine, it would take 2 weeks to show up clearly in the infection curve. Second, COVID-19 is disproportionately fatal the older a patient is, so many young people, all over the world, have ignored early isolation warnings, believing themselves invulnerable, and unaware that even people in their 20s and 30s can end up needing mechanical ventilation to survive with lifetime damage to their lungs. Third, COVID-19 is also unusual among high-mortality diseases in that it seems to seriously affect a comparatively small fraction of the population, leaving lots of asymptomatic carriers to slip through traditional epidemiological surveillance measures that rely on sick people reporting to doctors with identifiable symptoms. All this means that all over the world, officials have instituted isolation and lockdown orders later than they should have, and they have been less widely enforced and respected than they needed to be. But once in place, lockdowns have indeed curbed infection. Here are a few likely reasons why COVID-19 continues to spread. Most of us are not on lockdown. Policies vary from one country to the next and by region within countries. Lockdowns were implemented too late, after the virus had already had time to spread. Many people are not following the lockdown and social distancing procedures or other recommendations in their locales. Some people do not seem to understand how serious this problem really is. Inadequate testing is being done in many countries, particularly the US. This makes it difficult to identify and isolate those who have been infected. COVID-19 has a long and varied incubation period ranging from 1 to 14 days. Someone could be infected for almost 2 weeks before showing any symptoms. Many infected people are asymptomatic. They can spread the disease without ever becoming sick themselves. Estimating the asymptomatic proportion of coronavirus disease 2019, COVID-19, cases on board the Diamond Princess cruise ship, Yokohama, Japan, 2020 estimated that 17.9% of those infected are asymptomatic. That article mentioned data from another group that estimated 33.3% were asymptomatic. The countries that have been successful at slowing down the transmission of the disease have been doing rigorous testing of the population and tracing the contacts of the people who test positive. They have then been isolating those that test positive and have also quarantined suspected cases. They have also communicated clear and consistent messages to their citizens, and their citizens have followed the appropriate recommendations. If you could test everyone in a region and quarantine everyone who has been infected as well as everyone with whom they've been in contact, you could stop the spread. People could be released from quarantine if they test negative after 14 days or for those who are sick after they recover and are no longer infectious. Such a region would then need to maintain isolation from outsiders to ensure that new cases were not brought into the region. Most of the people who are spreading COVID-19 are unaware that they have it. In some cases this is because they have been exposed but have yet to become sick. In other cases it is because they are asymptomatic. Any infected person, who is not following full social distancing and related protocols can spread the disease to others. Given that any of us can be infected without knowing it, that means we all need to follow protocols. Staying at home as much as possible, washing hands, and keeping a distance of 6 feet apart from people when going on necessary errands can make a difference. Those who follow these guidelines are far less likely to transmit or catch the disease. COVID-19 has entered the general population and is being transmitted through the community even before anyone is diagnosed. This happens for 2 reasons. First, say a person gets the virus without even knowing it. He can spread it to others before he even has any symptoms. Second, he may never get symptoms, or may have symptoms so mild he thinks he just has a cold. Yet the people he passes the virus on to may get very sick or even die. Early on, even in late February, No one knew about asymptomatic cases or cases as mild as a cold. So, by the time a city or state says, "We have several, tested, proven, cases of coronavirus and our first death," that community probably already has several hundred people spreading coronavirus in the community. At that point, the city or state makes recommendations for social distancing and closes bars and gyms, and maybe restaurants. But this isn't enough. And especially where there is a shortage of tests, as there is here in the US, the spread of mild coronavirus with some flu-like cases may be quite wide before anyone knows the virus has arrived. For example, it initially appeared that West Virginia was slower in getting its first case than other states by several days. Now, it looks like they weren't testing when they should have been. We need to distinguish social distancing, lockdown, and quarantine. All are meant to slow the virus, but they are not the same. Social distancing is the mildest. Many activities go on as normal. People just stay further apart and wash their hands. Lockdown is more severe. The population is asked or told to stay at home and go out only for solitary exercise, essential shopping, essential employment, and medical care. Quarantine applies to people, and not usually to entire neighborhoods, towns, or cities. In quarantine, the person or people under quarantine are locked in and not allowed to leave. This is for people known to have, or very likely to have, COVID-19, including severe cases. But quarantine is difficult. Medical workers working on quarantined patients are risking their lives. People on quarantine need not only medicine, but also food. We have seen severe challenges already on cruise ships. This was a very bad situation because virus-free people were trapped in quarantine on cruise ships and being fed by workers who probably had the virus. So the quarantine infected many people and killed some. Now we are seeing quarantine in intensive care units. Some of the treatments used there, such as putting a person on a ventilator, easily spread the virus in a very dangerous way, so even healthcare workers and protective gear are in danger, and we have a shortage of protective gear. For each of these three methods of flattening the curve, social distancing, lockdown, and quarantine, the rule can be applied in two ways. They can be recommended or mandatory. Mandatory means that arrest, fines, and perhaps prison could be the results of breaking the rules. But, even where these instructions stop being guidelines and become mandatory, enforcement can be either more lax or more strict. The next crucial issue is compliance. People may intentionally ignore the rules, or even rebel against them. There was one no-lockdown rebellious coronavirus party where one participant now has confirmed COVID-19, and others are being tested. There have been some people who broke out of voluntary quarantine. Then there are accidental failures of compliance. These can come either from not understanding the rules or from mechanical breakdowns of the system. The earliest community spread in California may have been from healthcare workers who cared for American refugees from Wuhan quarantined on a California military base. They were not given adequate protective gear and got infected. They went home tired, stopping for pizza on the way home, and started spreading the virus without knowing. In such cases, one person might give the virus to 100 people. Most of these cases are never found and traced, but one was. A single attorney who worked on Wall Street and lived in Westchester County was directly responsible for infecting 100 people. In other cases we don't know. But it is possible one worker or family visitor brought the virus into a nursing home in Washington state which became a fatal hotspot. And then perhaps another care professional who worked at several facilities spread it around. There was one case where the initial infections for several European cities were all traced back to one very small ski resort town. It turns out that folks in that town were playing beer pong. Put a ping pong ball in your mouth, spit it across a table into a glass of beer, and someone else has to drink the beer. Instant saliva transmission in a game of fun. And these folks were sharing a coach's whistle, too. Then we have mass events of a similar character. New Orleans celebrated Mardi Gras around February 24th with lots of parades, drinking, and close dancing. About 5 weeks of spring break filled Florida and California beaches. Near the end of that, California went on lockdown. With businesses closed, people headed to the beach. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button before you go. Have a great day.